Welcome to the session on veterinary preventive medicine, presented by Dr. Sonal Joshi from GB Pant University and gnpsirclasses. Mastitis is an inflammation of the mammary gland, often seen in high milkers and animals of later parity. It can be acute, subclinical, chronic, or summer mastitis, each with distinct symptoms and treatments. Hemorrhagic septicemia is a highly fatal and contagious disease caused by Pasteurella multicida, leading to severe respiratory symptoms and requiring prompt treatment and vaccination. Brucellosis, caused by Brucella abortus, affects cattle's reproductive system, leading to late-term abortion and infertility. Diagnosis and vaccination are crucial for control. Tuberculosis in cattle and buffalo, caused by Mycobacterium bovis, leads to progressive emaciation and respiratory issues. Diagnosis and treatment are essential to manage this disease. John's disease, caused by Mycobacterium avium paratuberculosis, has a long incubation period and leads to chronic diarrhea and wasting in animals. Treatment involves antibiotics like rifamycin. Listeriosis, caused by Listeria monocytogenes, often occurs in winter and can lead to severe neurological symptoms and septicemia in animals. Prompt treatment is necessary. Leptospirosis, caused by Leptospira species, affects various animals, leading to symptoms like jaundice and kidney issues. Diagnosis involves specific staining and agglutination tests. Bovine genital campylobacteriosis, caused by Campylobacter fetus venerealis, leads to infertility and embryonic mortality in cattle. Diagnosis and treatment are essential for control. Actinomycosis, caused by Actinomyces bovis, results in chronic granulomatous abscesses in the maxilla and mandible, requiring specific antibiotic treatment. Actinobacillosis, caused by Actinobacillus lignieriacei, leads to granulomatous lesions in the tongue and requires surgical debridement and antibiotic treatment. Atrophic rhinitis in pigs, caused by Bordetella bronchiseptica, leads to nasal deformities and respiratory issues. Treatment and vaccination are crucial for management. Glanders, caused by Burkholderia malii, is a severe disease with high fever and respiratory symptoms, often leading to death. Diagnosis and control are critical. Strangles, caused by Streptococcus equa, affects horses and leads to abscess formation in lymphoid tissue. Treatment involves antibiotics and vaccination. Ulcerative lymphangitis, caused by Corynebacterium pseudotuberculosis, leads to painful inflammation and abscesses in horses. Long-term antibiotic treatment is required. Colobacillosis, caused by avian pathogenic E. coli, leads to high mortality in birds, causing septicemia and respiratory issues. Prompt antibiotic treatment is necessary. Fowl typhoid, caused by Salmonella gallinarum, affects all age groups of birds, leading to diarrhea and high mortality. Control involves antibiotic treatment and hygiene measures. Pullorum disease, caused by Salmonella pullorum, affects young birds, leading to high mortality and characteristic lesions. Control involves strict hygiene and management practices. Avian mycoplasmosis, caused by Mycoplasma gallisepticum, leads to respiratory issues in birds. Treatment involves antibiotics and control measures to prevent spread. Salmonellosis, caused by various Salmonella species, affects multiple animals, leading to diarrhea and systemic infections. Diagnosis and treatment are essential for control. Fowl salmonellosis is caused by various strains of Salmonella and spreads through horizontal transmission. Symptoms include somnolence, closed eyes, and diarrhea, often leading to immediate death. Postmortem findings reveal an unabsorbed yolk sac and an enlarged liver. Treatment is debatable due to high drug resistance, but gentamicin egg dip is used for control. Swine erysipelas, caused by Erysipelathrix ruchopatyi, is highly fatal and zoonotic. It presents with acute and chronic forms, leading to fever, lameness, and arthritis. Postmortem findings include petechial lesions and cauliflower-like growths in heart valves. Treatment involves procaine penicillin, and control focuses on reducing stress and maintaining hygiene. Contagious caprine pleuropneumonia, caused by Mycoplasma capricolum, affects goats and is listed in WA List B. It causes severe pleuropneumonia with high mortality. Symptoms include fever, nasal discharge, and rapid loss of condition. Treatment involves tylosin and vaccination with Longley's formalized or carbolized vaccine. Contagious bovine pleuropneumonia, caused by Mycoplasma mycoide, affects cattle and buffalo. It has an incubation period of 3 to 6 weeks and presents with fever, coughing, and abdominal respiration. Postmortem findings include severe pneumonia and yellow exudate in the pleura. Treatment involves tylosin. Clostridial infections, such as tetanus, are caused by Clostridium tetani, which releases toxins affecting the nervous system. Symptoms include muscle stiffness, hyperesthesia, and a sawhorse stance. Treatment involves penicillin and tetanus antitoxin, with immunization recommended biannually. Swollen head, braxy, and malignant edema are caused by Clostridium species. Symptoms range from non-hemorrhagic swelling to exudative, soft swelling with skin sloughing off. Treatment includes penicillin and anti-inflammatory drugs. Infectious necrotic hepatitis and black leg are caused by Clostridium species. Symptoms include necrotic lesions in the liver and severe muscle necrosis. Control involves vaccination and penicillin treatment. Bacillary hemoglobinuria, caused by Clostridium hemolyticum, leads to intravascular hemolysis and anemia. Postmortem findings include straw-colored kidney fluid and port wine urine. Treatment involves penicillin.
Clostridium perfringens types A, B, C, and D cause various diseases in animals, including necrotic enteritis and pulpy kidney disease.
Symptoms range from diarrhea to rapid onset autolysis. Treatment involves penicillin and vaccination. Botulism, caused by Clostridium botulinum, results from ingesting preformed toxins. Symptoms include muscle paralysis and respiratory failure. Treatment involves botulism antitoxin and proper disposal of carcasses. Ehrlichiosis, caused by Ehrlichia canis and transmitted by brown dog ticks, presents with fever, anemia, and lymphadenopathy. Treatment involves doxycycline, with prophylaxis using tetracycline or doxycycline. Chlamydiosis, caused by Chlamydia species, affects various animals and presents with conjunctival hyperemia and mucopurulent discharge. Diagnosis involves cytology, and treatment includes doxycycline. Q fever, caused by Coxiella burnettii, is transmitted by ticks and affects all species. It is highly zoonotic and can cause abortion in pregnant animals. Treatment involves tetracycline or doxycycline. Anaplasmosis, caused by Anaplasma species, is transmitted by mechanical vectors and affects older animals more severely. Symptoms include fever, anemia, and jaundice. Treatment involves OTC antibiotics. Fungal diseases like dermatophilisis and aspergillosis affect various animals, causing skin crusts and respiratory issues. Treatment involves antifungal medications and maintaining hygiene. Histoplasmosis, rhinosporidiosis, and coccidiomycosis are fungal infections affecting various animals. Symptoms range from respiratory issues to granulomatous lesions. Treatment involves antifungal drugs like ketoconazole and amphotericin B. Spirotrichosis, caused by Sporothrix schenkii, is a zoonotic fungal infection that can cause lymphocutaneous ulceration. Treatment involves antifungal drugs and creams. Mycotoxicosis, caused by various fungi, leads to toxin production affecting different organs. Symptoms range from gallbladder enlargement to gangrene. Treatment involves removing contaminated feed and supportive care. Fumonisin toxicosis, ochratoxicosis, and citrinin toxicity are caused by fungal toxins. Symptoms include nephrotoxicity and polyuria. Treatment involves removing contaminated feed and supportive care. Foot and mouth disease is caused by Aphthoviridae, with serotype O being common in India. Pigs act as amplifier hosts. Symptoms include fever followed by vesicles in the buccal mucosa and interdigit space, dysphagia, and recumbency. Necropsy reveals a tiger-striped appearance of the heart and degeneration of the pancreas. Diagnosis involves guinea pig inoculation, modified PCR, and blocking ELISA. Vaccination is done biannually with a tetravalent vaccine. Rinderpest is caused by morbillivirus, with pigs as reservoir hosts. Symptoms include fever and constipation followed by profuse diarrhea and oral necrotic lesions. Mortality can reach up to 100%. Necropsy shows zebra markings on the cecum. Vaccination involves goat tissue and tissue culture vaccines. Bovine viral diarrhea is caused by pestivirus. The source of infection is an immunotolerant persistently infected individual, and it can be transmitted horizontally or vertically. Another form, mucosal disease, affects 6 to 18-month-old bovines and is fatal. Symptoms include pyrexia, explosive diarrhea, oculonasal discharge, and mouth ulcers. Vaccination involves modified live BVD vaccine in non-pregnant animals and killed BVD vaccine in pregnant animals. Malignant catarrhal fever is caused by herpes virus and is fatal to cattle. It is transmitted by wildebeest, with sheep as indicator hosts and wild rabbits as reservoir hosts. Symptoms include fever, dysentery, diarrhea, encephalitis, incoordination, and more. Vaccines available are live and attenuated. Infectious bovine rhinotracheitis is caused by bovine herpes virus 1. It has 5 forms: respiratory, encephalitis in neonates, vulvovaginal, keratoconjunctivitis, and abortive. Diagnosis is through virus neutralization tests. Vaccines include live attenuated for non-pregnant and killed for pregnant animals. Ephemeral fever is caused by the Rhabdoviridae family and transmitted by vectors like sandflies, mosquitoes, and biting midges. Symptoms include sudden fever, ruminostasis, swelling of limbs, and sudden lameness. Animals recover in about 3 days, hence the name 3-day sickness. Blue tongue is caused by orbovirus and is highly fatal, primarily affecting sheep under 1 year of age. Vectors include culicoid mosquitoes and midges, with cattle as reservoir hosts. Symptoms include fever, nasal discharge, salivation, and more. Vaccines available are mono or quadrivalent live attenuated. Sheep pox is caused by Capripox DNA virus and is the most fatal of all pox diseases. Lesions develop in wool-less areas of the body. Symptoms include lacrimation, salivation, eyelid congestion, and respiratory distress. Mortality is about 50%. Vaccination is done intradermally at 3 months of age. Goat pox is caused by the Capripox virus, with lesions occurring on non-hairy parts. Symptoms include fever, lacrimation, salivation, and respiratory and gastrointestinal issues. Vaccination provides solid protection against both goat and sheep pox. PPR, caused by morbillivirus, affects young goats and sheep. Gathering predisposes animals to the disease. Symptoms include rhinitis, tongue protrusion, profuse salivation, and ulcerative mucosal lesions. Diagnosis is through competitive ELISA. Vaccination provides 12 months of immunity. Classical swine fever, also known as hog cholera, is caused by flavivirus and affects all age groups, with humans acting as mechanical transmitters. Symptoms include fever, vomiting, constipation, and more. Necropsy reveals a turkey egg appearance of the kidney. Vaccination is done at 2 months of age. Rabies is caused by the Lissa virus and leads to progressive viral encephalomalacia. Dogs are the primary reservoir, and transmission occurs via bites or saliva. Symptoms include irritability, dilated pupils, and ataxia. Vaccination is done post-exposure and pre-exposure at specified intervals. Equine influenza, also known as equine distemper or pink eye, is caused by equine influenza virus type A subtypes Equa1 and Equa2. It is transmitted via inhalation. Symptoms include fever, unproductive cough, and nostril congestion. The vaccine is called Prequenza. Equine infectious anemia is caused by lentivirus and transmitted by biting flies. Symptoms include emaciation, anemia, intermittent fever, and more. Anemia is due to immunological reasons. Diagnosis is through the Coggins test. Control involves population management. Equine rhinopneumonitis is caused by equine herpes virus 1 and 4, leading to abortion in mares. Symptoms include pharyngitis, nasal discharge, and nervous signs. Vaccination is done at 6 months, followed by a booster after 1 month, then biannually. Canine distemper is caused by morbillivirus and affects all members of the canine family. Symptoms include biphasic fever, green ocular discharge, and more. The nervous form is characterized by temporal twitching and continuous crying. Ferrets are used for diagnostic inoculation. Infectious canine hepatitis is caused by adenovirus types 1 and 2, with younger dogs being more susceptible. Symptoms include fever, vomiting, diarrhea, and more. Treatment involves fluid therapy and neomycin. Vaccination is done at 6 to 8 weeks of age. Canine parvoviral disease is caused by canine parvovirus 1 and transmitted feco-orally. It has 2 forms, enteritic and myocarditic. Symptoms include foul-smelling diarrhea and vomiting. Vaccination is done at 45 days, followed by a booster in 28 days. Feline rhinotracheitis is caused by feline herpes virus and transmitted via nasal, oral, and conjunctival routes. Symptoms include fever, sneezing, coughing, and more. Treatment involves doxycycline or fluoroquinolones. Vaccinated kittens may show limping syndrome. Feline panleukopenia, also known as feline distemper, is caused by feline panleukopenia virus 1 and transmitted feco-orally or by fleas. Symptoms include diarrhea, vomiting, fever, and more. Vaccination is live modified but can cause CNS disorders, so killed vaccines are used in pregnant queens and kittens. Feline infectious peritonitis is caused by feline coronaviruses and can be transmitted both horizontally and vertically. There are 2 types, dry and wet forms, with varying symptoms and severity. Unfortunately, there is no cure, but a vaccine is available for intranasal administration. Avian influenza, caused by Orthomyxoviridae, primarily affects aquatic birds like ducks. The H5N1 strain is highly virulent, leading to sudden mortality and severe symptoms. An inactivated vaccine is available for prevention. Newcastle disease, also known as avian distemper, is caused by avian paramyxovirus type 1. It primarily affects chickens and can be transmitted through fecal-oral routes or aerosols. There are several forms of the disease, each with distinct symptoms and severity. Vaccines are available for prevention. Mareks disease, caused by Gallus herpes virus, affects chickens and turkeys. It is transmitted via darkling beetles or inhalation. The disease has various forms, including neural, visceral, ocular, and muscular, each with specific symptoms. Vaccination is crucial for prevention. Infectious bronchitis, also known as gasping disease, is caused by a coronavirus and primarily affects chicks. It is transmitted via aerosols and leads to respiratory symptoms and stunted growth. Vaccination is essential for control. Infectious laryngotracheitis, caused by Gallus herpes virus, is transmitted via aerosols. It leads to respiratory symptoms and the formation of a diphtheric membrane in the trachea. Prevention through vaccination is important. Avian encephalomalacia, caused by P. corniverity, affects chickens less than 3 weeks old. It leads to progressive ataxia, tremors, and reduced egg production. Vaccination of breeders is recommended for prevention. Infectious bursal disease, also known as Gumboro disease, is caused by Byrnaviridae and affects the bursa of Fabricius in chickens. It leads to severe symptoms and high mortality rates. Vaccination is available for prevention. Chicken infectious anemia, caused by Cercoviridae, is primarily transmitted vertically. It leads to high mortality rates and aplastic anemia. Prevention through vaccination is crucial. Inclusion body hepatitis, hydropericardium syndrome is caused by adenovirus and affects chickens between 4 days to 4 weeks old. It leads to sudden mortality and severe symptoms. Vaccination is recommended for prevention. Valeria, caused by Valeria annulata in India, is transmitted by the Hyaloma tick. It affects various animals and leads to severe symptoms, including fever and anemia. Vaccination is available for prevention. Valeria species affect different animals, with specific vectors and symptoms. Valeria parva, Hirsi, and Lorenzi each have unique characteristics and require targeted prevention strategies. Trypanosomiasis, caused by trypanosoma, affects all species and is transmitted by Tabanid and Stomoxys flies. It leads to severe symptoms, including fever and neurological issues. Treatment options are available. Babesiosis, caused by Babesia species, affects various animals and is transmitted by ticks. It leads to severe symptoms, including fever and anemia. Treatment options are available. Babesia species affect different animals, with specific vectors and symptoms. Small and large form Babesia spp. Each have unique characteristics and require targeted prevention strategies. Leishmaniasis, caused by L. tropica and L. donovani, is transmitted by sand flies. It leads to severe symptoms, including skin lesions and organ enlargement. Treatment options are available. Thank you for watching. Don't forget to share, like, and subscribe to gnpsirclasses for more informative content.